My name is Doctor Dmitry Tsvetov, and I'm pleased to speak to you today about anesthesia options for your oral surgery procedures. It can be rather a confusing topic, so I'm hoping that this video today will allow you to become better informed in terms of your anesthesia options. When it comes to oral surgery procedures and anesthesia options available, you basically have 5 main choices. They are local anesthesia, the nitrous oxide, which is also known as laughing gas, oral sedation, intravenous or IV sedation, sometimes referred to as twilight anesthesia, and general anesthesia. So we are going to explore each one of these options in a little bit of detail. Local anesthesia basically means that the area to be operated on is numbed up using local anesthetics, and then the procedure is carried out. This can be applied to your single tooth extractions, your wisdom tooth extractions, as well as implant placements. The advantage of utilizing local anesthesia is that there is really no added cost to the patient. There is no need to fast beforehand, and there is also flexibility in terms of scheduling the procedure, because these procedures under local anesthesia can be carried out either in the mornings or in the afternoons. The disadvantage is that, of course, the patient is fully aware of the procedure. There is no amnesia component, and you may need to re-anesthetize the area repeatedly if the patient feels any discomfort during the procedure. Also, and this is very important, local anesthetics will not get rid of the pressure and pushing sensation during the procedure. The pain will be taken away, but the pressure and the pushing sensation will remain. And this can sometimes be a little unsettling for some patients. The next anesthesia option that we are going to discuss is the nitrous oxide, which is also known as the laughing gas. Basically what happens is that the patient inhales the laughing gas during the procedure through the nose, and this actually relaxes the patient and also provides a small level of analgesia or pain control. The advantage of using this particular technique is that it is very quick in terms of its onset, and also recovery is rather quick as well. And the patient does not need a driver to bring them to the appointment. They can drive themselves to and from the appointment. There is no need to fast or to have an empty stomach before the procedure, and there is a very small financial cost to the patient for this particular anesthesia option. The disadvantages are that this is not a very potent agent, which means that a very small subset of patients will not really fully feel the clinical effects of the gas, and also the patient needs to be willing and able to breathe through the nose to be able to inhale the laughing gas, which means patients with the nasal obstruction or deviated septums can sometimes have a little bit of trouble with this particular technique. Pressure and pushing sensation is, of course, still felt by the patient throughout the procedure, because there is really no way to get rid of that. As we discussed before, the pain is not actually perceived, but the pushing and the pressure is. The next option we are going to discuss is oral sedation, and what this basically means is that usually 1 hour before the procedure, the patient takes a tablet or a pill by mouth, and what this allows is for the medication to have adequate time to work before the procedure, and then once the effects of the medications have become clinically evident, then the procedure can be started. This particular medication typically reduces anxiety and provides an amount of amnesia as well. Typically, this is a very useful technique with children who may be anxious about the procedure but may still be willing to undergo it as long as they're adequately numbed up. And so, typically speaking, the parent would bring the child into the office an hour before the procedure. The child would ingest the medication, and then an hour or so later, the procedure can be carried out. Now, the oral sedation can also be performed in conjunction with using the laughing gas and, of course, the local anesthetic. And the three modalities of anesthesia in this particular case would have a synergistic or a combined effect to make the procedure very comfortable for the patient. Advantage of this particular technique is that it's a very low cost and low risk option as long as, and this is incredibly important, the medication is administered at the right dosage for the patient. It's definitely possible to overdose somebody with this particular technique, and therefore the provider needs to be extremely careful and really be aware of the weight of the patient and administer the dose that is appropriate for that particular patient. The disadvantage is that orally administered medications depend on being processed through the gastrointestinal or the GI tract, which means the clinical effects can be varied both in terms of the intensity and in terms of the timing. For example, somebody can take roughly 45 minutes to digest the medication, and therefore the clinical effects will be seen in 45 minutes. On the other hand, another person may take longer, say an hour and 15 minutes or an hour and a half. And the provider of anesthesia really needs to judge the situation critically and to be able to determine when is the patient truly ready for the procedure. A mistake that sometimes can lead to very drastic results is that when the provider does not see the effects of the medication in an expected time, they often redose the medication again, and that can lead to a bad outcome because, again, as I mentioned before, we should not be dosing the patient with that particular medication, but rather allow the proper dosage of the medication take the clinical effect. Another disadvantage of the procedure is that the patient is typically expected to be in the office about an hour beforehand so that the medication can be administered and the patient can be monitored in the office while the medication is taking effect. And of course, after the procedure, the patient will need a driver to bring them home because they will not be able to drive the vehicle due to them still being under the effect of the orally ingested medication. The next level of anesthesia is what we call intravenous sedation, which is also referred to in layman's terms as twilight anesthesia or twilight sleep. And what this means is that an IV is started. An IV is basically an intravenous catheter, kind of like getting your blood drawn in the lab. Now, once the IV is established, then the provider can administer the medications to reduce anxiety, reduce pain, and to induce amnesia, so patients have no recollections of the event. And also, of course, to sedate the patient to allow them to to be able to go through the procedure comfortably. The advantage of this, as opposed to an orally ingested medication, is that the effects of the intravenously administered medications are seen much more quickly, within 1 to 5 minutes, which is very useful because the patient does not need to wait in the office for a whole hour like they do when the medication is administered by mouth. And generally speaking, the patient is sleeping or is comfortably sedated for the duration of the procedure, so that the provider can carry on with the procedure and complete it in a short amount of time. So the advantages of intravenous sedation are that the patient basically is going to sleep, and then they wake up when the procedure is over, and the patient does not feel anything, not even pressure or pushing sensation that they do feel when they're not asleep and just numbed up with a local anesthetic. The disadvantages are as follows. Of course, there is an increased cost to the patient. And this is, generally speaking, a little bit more expensive than the nitrous oxide and oral sedation options. Also, not everybody is a candidate for this particular anesthesia option, and the main reason behind it is the airway anatomy. What I mean by that is that in a patient who has a very large tongue and a very narrow throat, it would be very difficult for them to be able to continue to breathe on their own during the procedure, because when we go to sleep, of course, there is a relaxation of the muscles, including the muscles that are supporting the airway. And so if the patient goes to sleep and they already have a very narrow airway, and their airway further collapses with the administration of these particular medications, there is a very good chance that the patient will become what we call apneic, or they will stop breathing, which of course is not a good situation. So before the patient is put to sleep, typically speaking, during the consultation appointment, an evaluation is made to see whether or not the patient is a good candidate for being put to sleep with intravenous sedation. And I'm very upfront with my patients. Typically speaking, if they're not a candidate, I will inform them about that, and we will be looking for other options to allow them to undergo the procedure and be comfortable throughout the procedure as well. Another disadvantage of this particular option is that the patient does indeed need to have an empty stomach. That means typically they need to fast for 6 to 8 hours prior to the procedure. This is also not an ideal option for longer procedures that take longer than 1 hour, because it's very challenging to keep the patient comfortably asleep for longer than an hour. It requires repeated doses of the medications, which typically speaking, the intravenous medications are very short acting, but similar to the oral medications, it is better not to repeatedly keep giving the patient the anesthetic, because there is a risk for the anesthetic building up in the body and resulting in adverse effects. The patient does need to have a driver with them to drive them home after the procedure, because very similar to the oral sedation, the patient will not be able to do it by themselves. The recovery time from intravenous sedation is a little bit longer, typically speaking 20 to 30 minutes after the completion of the procedure, and so the patient will be expected to spend additional time in the office recovering from the procedure, which is absolutely necessary to ensure the safety of the patient. And last but not least, even once they're dismissed back to home after the procedure, they're still going to be feeling a little groggy and sleepy for the rest of the day. So I consider this a disadvantage because the patient is not able to go about carrying out their daily chores and tasks. The last option that we will speak about is general anesthesia. So what that means is general anesthesia is a much deeper level of sleep compared to IV sedation. It is usually reserved for longer procedures, 1 hour and up, and a dedicated anesthesiologist, another physician, is always present during the procedure. That way the surgeon concentrates on doing the surgery, and the anesthesiologist is concentrating on putting the patient to sleep and then keeping them comfortably sleeping throughout the procedure, and then of course waking the patient up after the procedure. Intubation or the breathing tube is required to maintain the airway. Coming back to what we spoke about with intravenous sedations and about the airway musculature relaxing when the patient is asleep, this happens to an even greater extent with the general anesthesia, and therefore a breathing tube or the device to protect the airway is absolutely necessary to provide adequate oxygenation levels throughout the procedure. So this actually is an option for the patients who are not candidates for intravenous sedation because of the airway anatomy, but the procedure can still be carried out with full general anesthesia and with the airway being fully protected. Advantage of general anesthesia is that almost everybody is a candidate. The only people who are not candidates for general anesthesia are those with severe, debilitating, and uncontrolled medical conditions who would not basically be able to even survive being put to sleep, because general anesthesia does put some stress on the body, and we are dependent on the patient's vital organs to be able to carry out their functions while they're asleep. And so if one or more of these organs are not functioning properly, be it the heart or the lungs or the liver, the general anesthesia might truly be lethal for the patient. And so those patients, of course, it's a very small subset of the general population, but they would not be candidates for general anesthesia. The patient is fully and completely asleep, and like I mentioned before, a dedicated anesthesiologist is monitoring the patient. The disadvantages are the cost. This is by far the most expensive modality when it comes to administering anesthesia. And in terms of the scheduling, these are only done in the mornings. The recovery is usually a little bit longer than after IV sedation, usually on the order of a half an hour to 45 minutes after the procedure. And intubation is required, like I mentioned, which sometimes can result in patient having a sore throat for a couple of days after the procedure. So this brings us to the end of the discussion of the anesthesia options. I hope this video was informative, and I hope that the questions that you had regarding your anesthesia options have been answered. Again, my name is Dr. Dmitry Tsvetov, and I truly appreciate your attention. Thank you very much.